Dr. Mia, you'll be talking to Mrs. Holly or Molly, whatever.
Is it Holly?
Mrs.
Holly, ma'am.
Yeah,
Okay.
yeah, mother of Sarah. She is 13 years of age, and she's here in the emergency room with abnormal movements. Please talk to the mother and take full history. Okay?
Okay, ma'am.
I'm gonna give you 4 minutes. I just need to get chargers here. Okay, so 4 minutes, please.
Hello, I'm Dr. Miet. I'm doctor in the hospital. So am I talking to Miss Holly, the mother of Sarah?
Yes, that would be me, doctor.
Okay. Like Miss Holly, I've been told you have concern about some movement of Sarah. So I want to take down some notes. Is it okay with you, Miss Holly?
Yeah, totally fine, doctor.
Well, so what is the main concern coming to our hospital, Miss Holly?
I guess my child is having an epileptic seizure.
I'm sorry to hear that. So, like, can you tell me what happened before this event?
We were having an argument.
Okay. And then, what happened at the time?
Okay, the problem is she's insisting in going outside and partying every night, drinking alcohol with her boyfriend and with the rest of her friends. And I told her this is not accepted behavior. We got in the middle of argument, and all of a sudden she got a seizure.
All right. So can you like describe the movement, the pattern of her movement?
I guess it's her normal pattern, doctor. She's no case of epilepsy. I mean, she kept moving her arms and legs repetitively, drooling of the saliva, upcrawling of her eyes. She did all that.
Okay. So, what happened after the event?
I got her here in the hospital, and they have given her some medication because the seizures was not ending on her own. I even did the oral medication. It didn't end it, so I called an ambulance, and she came here, and they ended the seizure. Now she's sleeping.
Okay. So how long she have been having this event? Like, how many minutes she been having the seizure?
I guess 6 minutes till the ambulance
All right.
arrived.
Okay. So, like, is there any drowsiness or dizziness after the event?
She's still sleeping right now, so I don't know. I guess we will figure it out.
Okay. So, all right. I want to ask you a question, Miss Holly. So, like, well, does it?
Dr. Miyat, I
Does
have
it
a
take?
comment. I'm sorry, I
Okay.
forgot to say it in the previous scenario. You are not allowed to touch your face in the scenario. Sorry.
Okay. Okay. Does
Okay.
it could? Does it go? Okay. Can I start again, Mom? I mean,
I stopped
okay.
the time. I stopped the time, but
Okay.
don't
Okay.
touch your face because you're doing it a lot.
Okay. Okay. So you can start again, Mom. Okay. So
Okay.
for that, all right. She have no case of epilepsy. You have been told. So, how many times she have been having during these days?
Recently, she got her seizures increased. I mean, the previous seizure was like 2 weeks ago. The previous one was like also 2 weeks ago. And doctor, we had the seizure after a period of 3 months without any seizure.
Period 3 months only. Oh, all right. So when was she was diagnosed?
She was diagnosed with epilepsy with the beginning of 2023, the beginning of this year.
All right. Who diagnosed it?
The JB, she had a seizure, and then he sent us home and we vegetated it, and then they did EEG.
All right. So is there any medication she been taking?
Yeah, she's supposed to take sodium valproate.
All right. Does she take regularly this medication?
Her, not his. I'm not aware of that. And when I ask her, oh my gosh, it start a fight and start an argument, I'm tired of that. I don't know why she's giving me such a hard time.
I'm sorry to hear that. So, all right. Or does she take? Does she any other chronic condition apart from this epilepsy?
No, just epilepsy.
Any other concern, Miss Holly?
No.
Well, okay. What makes her symptom worse? This epilepsy.
I guess when she's drinking and when she gets upset, if she's staying late at night.
All right. So, what is the symptom relief?
I don't know. Because nothing relieve her symptoms. I don't know if there is something to make her epilepsy better.
Well, I want to ask you a question, Miss Holly. So, is there any fever during these days?
No fever.
Well, have you noticed any shortness of breath?
No.
Any awareness of heartbeat?
No, I don't think so.
Any cough?
At the moment, no.
Okay. Any like breathing difficulty?
I don't think so, doctor. No, she's fine at the moment before the seizures. But during the seizures, she started to snore, so that's why I called the ambulance.
All right. How about any throwing up?
No.
Any headache in the morning?
No.
Any vision problem?
She's wearing eyeglasses, so I guess she's having error of refraction, but otherwise she's okay.
All right. Any problem hearing?
No.
All right. So, all right. Okay. So, any problem with rashes?
She's having some acne on and off.
Any birth marks?
No.
All right. So, how about her pee?
Her pee is okay. She's peeing a lot recently. I have noticed that.
Well, any changes in color of pee?
No.
Okay. So, have you got any thirsty during these days?
No.
All right. So, how about poo?
I don't know. I'm not keeping track of those.
All right, it's okay. So have you noticed any joint pain, her like any part of the body, any
No,
swollen
no,
part?
no,
Like
no.
can you tell me about her walking style?
She's walking normally.
Any problem or like any drowsy or dizziness during these days?
No, no.
Okay, so like you haven't how many? Okay, this is one thing that any head trauma during these days.
She didn't tell me anything, but I don't trust her fully. I don't know.
Oh, I'm sorry to hear that. So any travel to any out of the country?
No, we cannot afford that.
It's okay, Miss Holly. And then any admission to hospital because of the epilepsy before that?
At the time of the diagnosis,
How many days she have been admitted?
she a few days till they confirms diagnosis.
So any admission to ICU because of that?
No, no, no.
Any blood test or lab test apart from EEG?
I thought no, no, only the AJ.
Okay. So all right, I want to ask you a question. Like, can you tell me like her birth history?
An eventful doctor.
Like, is there any like yellow discoloration during birth, after birth?
No, 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 no.
Like any admission to like intensive care unit after birth?
No, no,
Any uh like ear discharge or some bugs in brain after birth?
no, no, doctor.
Okay. So I want to ask you a question. How about her diet?
Oh, this is another problem. She is dieting excessively. I don't know why. I guess her weight is within average. She's actually skinny, but that's never enough for her.
All right. Have you
For a
have you
minute.
noticed any weight loss you've been having?
Yeah, she's skinny. She's
Hmm.
dieting.
How about her height?
Her height, I guess it's okay.
Okay, I want to ask you a question. So, uh, does it start period? Her period?
Yeah, she got a period and she's sexually active.
All right. Well, when was her last menstrual period?
I don't know. She never told me.
Like, have you noticed? Does she take any medication to arrest the period?
She's taking irregular, illegal medication.
All right. Like, does she take any alcohol?
Yeah, she's taking alcohol in the weekend.
All right. Have you noticed any problem with her boyfriend?
Yeah, doctor, he is encouraging her to drink alcohol and to take illegal medication. And I guess I hear the rumor from her friend telling me that he's planning to break up with her. And that's what I was trying to tell her before the episode. He's trying to break up with you. She didn't listen to me. She just started an argument.
I'm sorry to hear this. Okay. So, is there any bullying problem in school?
I don't think so.
Okay. So, like, how about her grades? Like, uh,
Very bad. Very bad.
yeah, because does she like difficulty in like following in school?
Yeah, and because sometimes one time she went to the school drunk. She cannot take her diagnosis really well. All the time she feel she should not be the one with this condition. She all the time feels so bad for herself. She has this
Okay.
self-pity.
All right. Does she like the teachers knows about her epilepsy?
Yes, they know she had a seizure in the school once, and she got really frustrated when they heard about it.
Any emergency medication they have been planned for her?
Yeah, I guess there's an emergency plan.
All right. So, can you tell me more about your family, Miss Holly?
Yeah, it's me and her father. Her father is having a problem. He's in a wheelchair. This happened about 3 years ago in a road traffic accident. He's working all night from home, and I'm working outside.
Okay. So, is there any problem during these days between you and your daughters and your father, your
And no, I
husband?
just want her to be okay, but she never accepts any criticism, and she starts an argument.
All right. Is there any family member who have epilepsy like that apart from her?
I always heard that there was a family relative that he had epilepsy and he died from a prolonged seizure. I have never met him.
All right. Okay. So, how does it like? Does she sleep during these days?
She's asleep, but she's not sleeping enough.
Okay. Does she commit suicide or some like
No, no,
harming
no, no.
herself?
I don't think so. No.
Right. Okay. All right. Have you noticed any out of your question? Does she take some OC pill?
Contraception? I
Yeah.
wish. I don't know. I don't know,
All
doctor.
right.
I don't think so.
So, can you imagine how does she affect because of this problem in her daily life?
I don't know, but her life is miserable. I don't feel happy because about her. I'm worried about her.
But how does it affect you and your family?
It's heartbreaking. I have to say that.
I understand how much. Is there any other concern, Miss Holly, apart from epilepsy?
Uh, no other concern.
All right. One question I
Is
want
it
to
your
ask you, Miss
case? Your time is over. Your time is over.
Okay. Today I have here taken history from Miss Holly, the mother of Sarah, 13-year-old. According to my mother, she's been having abnormal movement, like how to say that, still like seizure, which is precipitating arguing and incident between family, and then the seizures that even is 6 minutes, and then she having dizziness after giving some medication by emergency department, and she having admitted hospital a few days, and then she had been diagnosed with epilepsy from 2023, and then increasing during these days, and then she didn't catch up or follow up medication for epilepsy, and there's a psychosocial problem between mothers and daughters, which can precipitate that, and then she's also half achiever, and then she had problem with diet, which might be the anorexia nervosa. According to findings, my findings with Sarah having the conditions, depression with underlying epilepsy.
Why do you think she's having depression?
No, sorry. Because she having fighting, she having problem, social problem with mothers and boyfriends, and taking drugs, illegal drugs, these things.
So your diagnosis is poorly controlled epilepsy case, right?
Yeah, poorly controlled epilepsy. Yeah.
Okay.
Exactly.
So can you tell me, you are now in the emergency room, and they got you this girl sneezing and then seizure. Tell me please your management plan with this girl.
First, I will check her vitals and airway. Any other problem in airway? And then, is there any problem in breathing? And then, is there any other shock or circulation? I will give some bolus, and I would like to do some blood glucose. Is there any hypoglycemia problem or not?
Because okay, this at which minute? Which stage at which minute? You have to be specific.
0 minutes. 0.
Okay. And then what? What is the next step? At which time?
And then, IV, lorazepam, we have to give. But here, we have to check if there any emergency team have been given buccal midazolam or not before coming to the hospital. If one dose of buccal midazolam have been given, we might have to give only IV lorazepam for one time, because we have to give only 2 doses of these any sleep medications.
Okay,
then if the seizure have been having more than this, and after 15 minutes, then 15 minutes to 25 minutes, we have to give some phenytoin. If she have been taking phenytoin, we have to give phenobarbital, and then we have to urgent seek advice from the consultant and anesthetist. If the seizure cannot be controlled after 25 minutes, and then it's longer, then we have to do some intubations, and we have to RSI, rapid sequence induction with thiopental, by anesthetist and by neurologist and consultant appearance, and we have to transfer to ICU as soon as possible.
Okay, good job. Missing a few points, but good job. Okay, so can you tell me please when you will refer a patient with epilepsy to a tertiary center?
Well, there's 3 things. If she have been if the seizure has been worsening after taking second medications, and then age is less than 2 years, we need to refer as soon as possible. And there's a side effect, serious side effect after taking any epileptic drugs. And then diagnosis is uncertain, and then the child having psychosocial problem like that. This is the refer we have to soon. Immediately we have to refer is some behavior or epilepsy cannot be controlled, and then some syndrome such as Touch-Weaver or some encephalitis.
What you will do if the child is having Ramsman, encephalitis, hypothalamic hamartoma, you will refer urgently or what?
Well, we have to refer the specialist, doctor.
Is it urgent or soon,
no,
or refer at any time?
Soon after stabilization.
Okay, so can you tell me how you will withdraw the anti-epileptic medications?
Well, after the seizure, the seizure-free period for 2 years, we need to start withdrawing the anti-epileptic. But some anti-epileptic might take 3 months, but some anti-epileptic might take 6 months. But if the child having important things, like for example, some exam or some important life measure, then we need to withdraw after having taken that exam or some event. We need to withdraw or postpone the withdrawal after having stabilizing her condition.
Okay. So can you please tell me what are the indication of doing EEG in a patient with epilepsy, and when not to do EEG?
Well, EEG not indicated in stable generalized tonic-clonic, not and febrile seizure, and then funny movements, some tonic tics. These things we don't need to do. After control taking medications, control stable. After taking medication and control generalized tonic-clonic seizure, we don't need to do the EEG. But EEG we must done in a focal epilepsy, some West syndrome, tuberous sclerosis, myoclonic seizure, intractable seizure, or some loss of follow or some behavior changes, or some Rett syndrome, or some developmental regression.
Okay, so what are the indications of MRI brain in patients with epilepsy?
Same there's a West syndrome, or some myoclonic jacks, or some developmental regressions, intractable seizure, epilepsy less than 2 years, then we need to do the MRI.
Okay, doctor. So what will be your next steps after stabilizing this child and her management?
After that, after stabilizing the child, I would like to discuss with my consultant neurologist. And then after she having confirming the epilepsy, we need to give some advice for epilepsy medication. That we have referred to epilepsy enough to regularly taking medication, regularly monitoring she having taking medication. Not we teach mother when to give and how to give. And then she having 13 years. So one of the things we need to give, she having sexually active. So we need to treat this problem. We have if she having taking some OCP, or we need to discuss with the epilepsy nurse, epilepsy team to give appropriate medication for her.
What do you mean by that?
If the child she hasn't taken sodium beverage, she said, and she hasn't taking contraceptive pills, because contraceptive pills and sodium beverage have some side effect on her.
What do you think is the proper anti-epileptic medication for her?
Uh, lamotrigine?
Yeah, do you think she's taking folic acid or not?
I don't think so. She ain't taking folic acid, ma'am.
Did you ask?
No.
So,
But she
what is your
any
what's your advice for this family?
also we have to give some folic acid medications, folic acid medications, and advice of some seizure protective measurements for her daughter, and then advice to take regular medications, advice to follow up with epilepsy team and epilepsy nurse, and then proper home menu modification for epilepsy patient.
Yeah, like what?
Why? Like the door hasn't been closed during like taking bath, or some she can bath alone, or like door closed at the time, or some firing matter problem, or electrical like shock or electrical bonding problem, and then some height or some if she's sleepwalking or some epilepsy measure advice from I think.
When she can get her driving license?
Yeah, after driving license, she having seizure free for 1 year, 2 years. She can she can take it 1 year, like she can take a driving lesson back, ma'am.
Okay. We will stop. Your time is over. Okay, Dr. Miat, I'm really happy that you really study the theory. To be honest, it's really, it's rarely to find a candidate that really studies the series that meticulous way and that accurate way. So you did a really good job in remembering the theory, and I was happy that you put in your mind our advice. I mean, when I was asking about indication of EEG, you didn't mention them all, but you didn't make me feel that there is something missing. Remember? It was you who we were discussing this issue with, right? And when the indication of MRI, you made me feel that you said it all. You are very confident in answering the question, but please pay attention to the body language when you are answering the question. You got really taken away in answering the question. So your hand should be steady on the table, okay? And of course, you're not allowed to touch your face. This is my comment regarding the discussion. Actually, you did a very good job, but I just wanted to hear. I will have to refer her to the sexual health clinic. You said that she will discuss with a nurse about that and this, but I want to refer her to the sexual health clinic by name. In the history, I don't think you missed anything, but I don't understand why in the middle of the scenario you asked me, what make it better and what make it worse? What? This is in the middle of the systemic review. I don't know why you did ask that. You didn't ask about the drawbacks of anti-epileptic medication. You should ask about trash, excessive hair, or hair loss, and you should ask about yellowish discoloration. That was missed. The folic acid was missed also. These are the points you have missed. Okay? So someone is encouraging you, but it's in Arabic, so I will translate it in one of the groups. Well done, perfect. You really understand your job. This comment was written to you in the group, but it was in Arabic. Okay, so back to this scenario. This child now is came here in an epileptic seizure. So this is an episodic event. So what happened before, what happened during, what happened after, and then any video recording. Then, is it the first time? Is it associated with fever? How frequent she is getting the episode? And in the past history, I will ask about the triggers in the past history, and I'm going to ask about head trauma. So the opening statement was not 100% clear. I was telling you she's having abnormal movements, but once the mother described it, and the mother told you that it's an epileptic seizure, she's known case of epilepsy, I guess you knew that this is epileptic seizure. So what happened before? What happened during? How she woke up from the seizure? What happened after? Did you videotape it? Did you do any video recording? And then I will ask about is it the first time? Is it associated with fever? And how frequent she's having it? And then I will ask any other chronic condition, any other concern, and then I proceed to the systemic review. When I have a case of epilepsy, basically what I should stress on in the systemic review is the CNS symptoms in all and the drawbacks of anti-epileptic medication. Why? Because I'm not allowed at the moment to ask about what medication she's taking. So I will just cover the drawbacks of the anti-epileptic medication, asking about rash, weight changes, asking about any excessive hair or hair loss and yellowish discoloration and increase the tummy size. Then the past history, how she was head trauma, bug infection in the brain, how she was diagnosed with epilepsy, when was that, and have you noticed anything in particular increase the seizures? What is this? This is about the triggers. When I'm asking you what increase the seizures or what makes the seizures happen, this is asking about the triggers. But why we cannot say triggers? Because some examiners unfortunately think that the triggers is jargon. And then I will ask, she's taking sodium valproate. I should ask about if she's taking it regularly. Okay, what happened when she missed a pill? Okay, if she's aware of the drawbacks, she's doing any follow-up with a nerve doctor. Okay, who else she's following up with? Any operation and any admission? You missed the operation, did you? You missed the operation, right? Hello, you missed it.
Yes, ma'am.
Okay. And then prenatal history, very, very quickly, feeding habits, measures covered, vaccines and allergy. And then that sexual history, you did it very well because you asked about the last period, sexual active or not, illegal medication, when using any protection from STDs. I guess you have missed this part, but it's okay, we're not keeping alive results. And then you move to the social and family history because you have to ask any home modification. I think you did not ask any home modification, and you did not ask about the emergency plan. Do you know how to use the Bakar Midazolam? Do you know what should be done? You asked about the emergency plan in school, but you didn't ask about the emergency plan at home and home modification.
Emergency plan home modification. Yes, ma'am.
Yeah. Okay. Are you with me so far? So
yes,
the examiner will tell you she's now in epileptic seizure. What you will do? So we have the table in the WhatsApp group. Yeah, and the step 1 was the time. You said it accurately, but you just did not mention the second dose of clonazepam. This was the only thing you have mentioned. But again, you are the best one who have discussed this table so far. Then I asked you some of the common questions, okay? So I asked you when you will refer her, how you will withdraw it, and the indication for MRI brain, all of this. Just a minute, please. I'm so sorry. Okay, so oops, I removed the screen. I'm sorry for that. Okay, let's continue. Then when I asked you what else you would do for her, in this that I will answer this question, Dr. Ilham, in a minute. So when I asked you what else you would do for her, I need to examine her neurologically first. I need to make sure she's neurologically okay. Maybe I will do fundus. I will be taking vitals and anthropometric measures. I will involve my senior if needed, my consultant. I have to run some tests. What do I need to do? Lab, radiology, plus number one, beta HCG. I think this answers your question, Dr. Ilham. She may be pregnant, that's why she's having frequency. She's not having polyuria, she's having frequency. Okay, and then what you will do? Sodium, valproate level, LFT, radiology, nothing, or if she's losing control of more than 2 antibiotic medications, so nothing here to be mentioned. Maybe ultrasound abdomen if I'm suspecting pregnancy, and nothing is a plus. And I will have to have a multidisciplinary team. We have to involve that she's already following with a neurologist. Yes, she have to be following with a sexual health clinic, and she maybe I need to involve psychology or maybe psychiatry according to their assessment and psychological support to the family. Advice about what? Advice about home modification, advice about avoiding the triggers. And the examiner will ask you what are the triggers, like what you asked me, staying late at night, fasting and alcohol, and of course advice about the lifestyle she is following. Is it clear?
Yes, ma'am.
If I asked you, Dr. Mia, do you think she is ready to be transferred to the adult service?
No.
Exactly. Because sometimes this scenario came before in UK. Okay, talk to the child to make sure she's ready to be transferred to the adult service. So of course she's not transferred to the adult service because she's not capable of taking care of herself, and she is not taking her medicine. She is alcoholic, whatever. Okay.
Yes, ma'am.
Where are the rest of the group? No alarms. No one is here. Where is everyone? Hello. So I don't know, Dr. Mia. If you can do a third scenario, to be great. If you can't, we just have to ask you. You can